Slice open a dark red beet, and you'll find one of the most reliable tools for human performance. Elite endurance athletes regularly consume concentrated beet juice 2 to 3 hours before a race. This specific protocol is used to increase stamina and delay muscle fatigue. In a clinical setting, doctors see similar acute effects. Trials show that giving a patient a dose of beet juice can drop their systolic blood pressure by several points within hours. Between the sports science literature and the cardiology data, the beet functions as a highly effective cardiovascular aid. But some clinical trials revealed a strange anomaly. Some patients drank the exact same beet juice and their blood pressure did not drop at all. Using an antibacterial mouthwash, like one containing chlorhexidine, immediately before drinking the juice completely neutralizes the cardiovascular benefits. The juice itself hasn't been altered. It still travels down the throat and into the stomach. So having a chemically clean mouth somehow stops the heart from benefiting. The beet's blood pressure lowering effect requires a biological partnership operating directly on the human tongue. A beet's primary chemical payload is dietary nitrate, or NO3-. Human bodies lack the necessary enzymes to process dietary nitrate. It simply bounces off our intestinal walls, passing through the digestive tract completely unused. Deep in the grooves on the dorsal surface of the tongue lives a dense colony of commensal bacteria. As you chew and swallow, these bacteria intercept dietary nitrate. They strip away a single oxygen atom, converting NO3- into nitrite, or NO2-. Antibacterial mouthwash indiscriminately slaughters these specific bacteria. Rinsing destroys the colony and halts this chemical conversion completely. Without those oral bacteria acting as chemical intermediaries, the beet's payload passes right through your system, rendering it biologically useless. If those bacteria are left intact, the newly formed nitrite is swallowed in our saliva and hits the highly acidic environment of the stomach. That stomach acid triggers a final chemical transformation. Nitrite becomes nitric oxide, or NO, rapidly entering the bloodstream and permeating surrounding tissue. Nitric oxide is a critical vasodilator, signaling the smooth muscle lining your blood vessels to instantly relax and widen. This simulated line graph shows exactly what happens next. As the vessel diameter expands, the fluid flow rate spikes upward. With wider pipes, peripheral resistance drops, meaning the heart doesn't have to work as hard, and the pressure gauge falls significantly. This mandatory chain reaction, moving from the root vegetable to the bacteria on the tongue and finally into the stomach, acts as a mechanical form of cardiovascular medicine. This process becomes vital as we age because human bodies naturally lose their ability to manufacture their own nitric oxide over time. The body's internal production system, known as the eNOS pathway, becomes compromised. This specific failure leads directly to stiff arteries, poor circulation, and chronic hypertension. The beet's enterosalivary pathway operates as a biological backdoor. It manually bypasses that failing internal system and forces nitric oxide directly into the blood vessel. For older adults facing arterial stiffness, eating nitrate-rich foods acts as a direct replacement strategy for a vital molecule the body can no longer produce on its own. Because this relies on a two-step bacterial conversion, it takes 2 to 3 hours for plasma nitrate levels to peak in the blood. That dictates the specific timing window athletes use to maximize their stamina before a race. Delivery methods matter. If you eat whole beets, you gain the added benefit of dietary fiber for digestion. But if you need the high-concentration nitrate doses required for acute blood pressure drops, juices and concentrated powders provide a denser payload. There are a few clinical caveats. Beets contain high levels of oxalates, which can trigger kidney stones in susceptible people. They also cause beeturia, a harmless side effect that temporarily turns your urine and stool red. Beets function as a cardiovascular powerhouse, provided you protect the delicate microbiome living in your mouth.